Well, good afternoon, everyone, and welcome to the April 13th, 2021 session in our series on entrepreneurship and Asian high-tech industries. I'm Richard Dasher. I direct the U.S. Asia Technology Management Center at Stanford. We're very proud to present this series, and we want to thank the member companies of the U.S. Asia Technology Management Center's Industry Affiliates Program for the funding that makes this program possible. Also want to remind everyone that we will have an informal session after the end of the regular program today. So our formal seminar will end at 5:50 p.m. Stanford time. And we'll hang around with as many people as would like to for a more informal conversation after the program is over. Very excited that today our presentation and discussion is going to be about healthcare entrepreneurship in China. A couple of announcements before we get started. First of all, remember that today is the line for students who are registered for credit to send in your comment on the March 30 session. Each comment is due within 2 weeks of the date of the session. There are still a few people who haven't sent in comments, although I'm happy to see that most of the class has already complied. Second point for students registering or considering registering, we're getting close to the drop ad deadline. I don't exactly know when it is, but please be careful about that. If you're planning to add the course or drop the course, better to probably do that this week. And I'd like to wish everyone a Happy New Year, where it is the beginning of the year 1943 in the peninsular Indian states. Thanks very much to Dr. Prabhash Habalkar, who has given that information to us. And you know, we're delighted that we have a mixed audience from all over, including people who are joining us probably from Brazil and other places as well. So today our speaker is a former student who I've had the privilege of knowing for a very long time. Shih-Hung Chen used to be the China representative of the U.S. Cooperative for International Patient Programs, which is an industry association of academic medical centers in the United States. But I've known Shih-Hung a lot further back than that. We were talking just before the program started and found out that this goes back to about 1998, when Shih-Hung was one of the founding members of the first Asia Pacific Student Entrepreneurship Summit, which later became ACES, which is now a global entrepreneurship community, but is still very active at Stanford. After graduating with his bachelor's at Stanford, Shih-Hung went to work for a Shanghainese office products company that was bought by Staples and then became Staples China. So he was in the top leadership of Staples China. At some point along the way, he got his MBA from the MIT Sloan School of Management. And now he is a serial entrepreneur and currently co-founder and CEO of Guliwang, which is an online platform that provides corporate gifts, food products, and employee benefits to corporate customers, including state-owned enterprises and banks and professional services. He is also helping the MIT program with their China lab, where he sources and manages company relationships. So I'm delighted that Shih-Hung can join us for this session about healthcare entrepreneurship in China. Shih-Hung, why don't I give the floor to you and ask if you will give us some prepared remarks to start.
Well, Dr. Dasher, it's such a pleasure to be on again, actually. This is it's quite an honor to sort of be on this side of the, the presentation rather than being on the student side, which strangely enough, I still remember from many, many years ago. It's again, it's a very much an honor. I'm talking to you guys from Shanghai, so if there is any breaks and stuff, please, I apologize in advance. As you know, sometimes the China internet is notoriously interesting. Let me put it that way. I guess that's the best way to describe it. Maybe another point of introduction from my perspective is that while my remarks are all basically on China and healthcare, and both these things are actually really interesting in the sense that they're really interesting cross section. My professional background is weird and maybe unusual for many people in that while I'm basically professionally Chinese, or specifically professionally mainland Chinese, I'm culturally American. So, I grew up completely in the United States. I mean, if you ask me where I'm from, I mean, I'm from Seattle. so that's where I'm from, and so it's sort of a different perspective in the sense that I'm looking at a lot of these opportunities as sort of an American, or you can say a foreigner, even though Asian American, as a foreigner looking into China. So hopefully that gives you sort of a perspective, and also maybe sets the mental model for how I'm looking at these things. As always, I mean, these are just my thoughts and comments. Right? I always have to start out a comment about healthcare in China with that sort of caveat, but these are just my observations and things like that. I'll grade. Why don't I just jump into the slides that I prepared? And these slides are actually from a presentation that I gave previously to the Industry Association, but I took a bunch out, and so I'll share it with people. The thing about, I also want to start out anything statistic wise and number wise about China with a big caveat. And I think most people who have actually been exposed to China related statistics know that the Chinese statistics are notoriously unreliable. And so the way I look at statistics, and when I look at market research from China, I look at it as a trend, not as necessarily the absolute numbers. So it's more important actually to see how things are trending over time than actually take a look at the absolute number of what it is now, because sometimes those it may not even be like a issue of intent, but it may be just an issue of it's hard to gather data in certain ways, and so sometimes the definitions are different, but trends are actually very useful. So I mean, the first trend, of course, is the increase in healthcare expenditure. I mean and so sorry. I mean the comments that I want to make is basically just give people a background about healthcare in China, because while I've been really exposed to this for many years now, Dr. Dasher mentioned it'd be useful to sort of give people a sort of a baseline, baseline of what healthcare is like, sort of the trends in healthcare, maybe the how people are experiencing healthcare out here, as well as some thoughts. I should also actually
let me interrupt you real quickly, okay? Because one thing that you and I had talked about is the definition of healthcare.
Yes.
Right. You're looking primarily at services, right?
Yeah. So I mean, I was going to jump in and say that the slides that I prepared here are actually specifically focused on there's actually Dr. Dasher and I spoke earlier, and we sort of think together think that there's really sort of a 3 cones of healthcare. So when you talk about healthcare, it's just too easy to say, I'm in the healthcare industry. But I mean, and even within these like 3 broad definitions, there's so much, it's so much broader than that. But I'll generally describe it in 3 broad definitions. And the 3 broad definitions are: 1, pharma, and that's basically all drugs, and even within pharma, there's tons of delineation within. You have chemistry, you have biologics, you have cell, et cetera. So, but that's one side. The second area that I would describe is medical device. And even within medical device, we have things ranging from things like Linux to PET CTs, to anything of like consumables, right? These are all, basically medical med device areas. And the area that I think, I know the best, those areas are huge markets in themselves. I'm really not in a position to talk about this. And it's very difficult to find anyone, I think, who can really be an expert in all three. The area that I probably know the best right now is the services side, and specifically the provider services side here in China. So the services side is you can argue it's retail, right? It's healthcare retail, which is it's delivered point of service, specialties, and hospitals, clinics, and things like that, or any sort of more innovative models that you're seeing, but it's surrounding services. So hopefully that I think that covers that, Dr. Dasher. Or
yeah, that's great. Absolutely.
And so when I jump into this about healthcare, I mean, this particular slide that we're looking at is basically the entire sort of percentage of GDP that we see, and you see that number in the U.S. It's the U.S. number is I think 16 or 17%. Yeah. The China number is much lower as a percentage of GDP, but it really it needs to. I think the most comparable numbers are something that where that I think Europe is maybe around 10 or something, and so China is not at that number yet, but it is getting close to it, right? And so that's sort of the trend where basically the end result is more money will be spent on healthcare. I mean, if there's anything take away from this slide is that China will need to actually spend more on healthcare in order to get to sort of a number that's comparable with maybe not the U.S. but the rest of the world. Let's see. Let me go to this. The other thing that's interesting, and I think you've seen the demographics of China is changing rapidly. People have talked a lot about China's probably going to be this first society to sort of age before they get rich, and that has a tremendous impact on healthcare services. A lot of people, most healthcare services, about 80% of a person's lifetime, sort of spend on healthcare is spent in the last, I think the last couple of years of their life. And so as a result of this, you can see the trend. If you're aging really rapidly, then this number is actually going to become, it really rapidly changes your entire definition of what what sort of diseases that you're going to have to deal with, as well as sort of the spend that you are. So this slide basically just I think this is nothing extremely new. I mean, most people know China is aging rapidly. The healthcare resources, and this is an interesting number. Okay, I mean, it's basically with regards to you have what's the public hospital system and the private hospital system, and I'll jump into that a little more to describe what the public and private hospital system is. It's for good or for worse. When you take a look at this number, it's a little deceptive in the sense that when you look at the the number of hospitals. And quotes and the beds and these hospitals also include TCM, and that's what this means by Chinese medicine, traditional Chinese medicine. Usually it's abbreviated into TCM. But you see that there's more private hospitals than there are public, but it's deceptive in the sense that if you compare them by the number of hospitals, there are more private hospitals, but by volume, the public hospital system is something like 80%. Basically takes care of about 80% of Chinese population, the Chinese population, and there's also a resource sort of disparity as well, in the sense that the public hospitals have academic funding. They also have, they basically have all the resources, and whereas the privates actually sort of have to fight for that. But the interesting thing about this is that the private numbers are increasing. So for good or for worse, even though the public hospital system dominates the market, there is quite a bit of room and growth for the private sector, specifically focused on areas that you can say the public sector is not doing very well at.
Shih-Hung, can I ask you a little bit more about that? So sure. These private sector hospitals, the image I'm getting is kind of small, maybe family clinics almost, if you say that there's a lot of them, but that the public hospitals are doing most of the healthcare providing. But are these targeting the high end of the market, or are they targeting special groups that are kind of underserved, or how do they fit into the system?
So why don't I just show you a picture of what a couple of these private hospitals look like. So I mean, the one that we're looking in particular that I'm showing, there's these two slides here. These organizations, I mean, these clinics are actually, I mean, the first one is not a clinic. You know, when you look at the top one, Jiahui Health, that is a major hospital. It's basically, I think, a 2,000 bed hospital that was built in collaboration with the Massachusetts General Hospital, MGH, Mass Gen, and specifically, actually not even Mass Gen, it was Partners Healthcare. Was the organization that worked with Jiahui to actually build this hospital. This hospital's large, and they basically are so they're fully equipped to do cancer care. I think they have 2 or 3 linear accelerators in the bottom, but this is a general hospital. It's one of the few. I mean, there's quite a few public hospitals, but sorry, I mean, there's private hospitals that are like this, but so this is one category of private clinic or private hospital association. I mean, private hospital entity. I would say they're not as much as what you see below, which is, when we say like Sino United, this is actually a VC invested clinic, and it's a chain of and this is high end. And there's also in China, there's also United Family Parkway, and these are what I would call sort of the higher end sort of clinics. There's not only higher end clinics. I mean, there's actually also what we call very low end clinics. I haven't really talked about them at all in these slides, mostly because this is the part where there's part of me that finds them a little sketchy. These slides, a lot of them are known sort of a little bit derogatorily as what's called the Putianxi. And the reason why they're called Putianxi is because many of the investors actually are around the Putian area in Fujian province. Somehow they're all linked to that province from ownership perspective, and so a lot of them are being referred to as what was called the Putian system of private clinics. And these private clinics are basically focused on very convenient. Prices are relatively low, but they're sort of they're very focused on procedures. And it depends on what category of procedures. Sometimes you just can't wait. You don't want to wait in line at the hospital, or so that you have these hospital. I mean these clinics that are there as well. From the perspective of USKIP and the perspective of how we had looked at it, I mean, we basically sort of somewhat ignore that particular market, mostly because of the fact that it's very difficult for U.S. hospitals, in particular, to work with them. Now, a public hospital looks like this. These are 2 pictures of what sort of a major 3-tier tier 3 hospital. And again, I should have maybe jumped into this and say that the way that the hospital system, the public hospital systems are classified, you have basically 1, 2, and 3, with 3 being basically what we consider in the U.S. Tertiary or quaternary care facilities. So a top what's called a 3A hospital would be basically the equivalent of a Stanford Healthcare, Stanford Medical. That sort of 3A hospitals are usually academic medical centers, and there'd be a hospital like Hunan Hospital would be you could say in prestige and reputation is comparable to within China, of course, to places like you could argue a UCSF or a Stanford type of thing. If you're in the medical profession, I know people, if they're online, that they might have some debate about this, but it's that within the country, okay, each of these hospitals, these 3A hospitals, especially in the prominent cities, Shanghai, Beijing, and Guangzhou are considered the most prestigious places. However, as you can see, I mean, the pictures that are taken here are not atypical of a daily experience at the hospital. I mean, you're seeing, daily outpatient numbers that are 12,000 and above a day, right? I mean, so I often mention that when you go see a hospital in China, especially at the top hospitals, I mean, you're basically fighting Black Friday lines every day. I mean, and people treat it like this, I mean, they get to, you see people get to the hospital at 4 or 5 a.m. in order to line up to see a doctor. And as a result of that, these patient encounters that I mentioned here are only 2 to 3 minutes. And so this also leads to the fact that, you have, I mean, this is that you see, or people who have been following healthcare, there's been a lot of tension between patients and doctors. And, there's been, numerous cases of doctors being attacked or by patients, and it has a lot to do with this really terrible experience, right? I mean, you already as a patient are already feeling very bad, and so I mean, you have to get there at 4 a.m. to wait in line, and then you basically are fighting all these people in line. As you can see, this picture is not atypical of. I mean, this is a very typical day at a hospital. You have to fight everyone for getting in the line, and then even once when you're basically being treated or you're being seen by the doctor, 2-3 minutes, and then you have a whole ton of people outside that are waiting to try to see the doctor. And so it's very, very stressful experience. And I think the bigger problem is the lack of continuity of care. I mean, for people in the Western U.S. system, as you know, I mean, there actually is a very good continuity of care. Usually, you're being guided by a PCP, right, or a primary care provider that guides you through the system, and then when you actually enter it. In the case of, let's say oncology and cancer in particular, you usually have a primary oncologist that actually works with you, and then you pull in specialists. Within the Chinese hospital system, you're sort of on your own. I mean, you have to fight your own system, and a lot of times it's not even the fact that the doctors aren't willing to guide you. It's just they literally don't have time. I mean, when you're dealing with, a lot of the clinicians that I know here. I mean, just in the morning, I mean, they have to deal with 200 patients. By the time you get from 8 to noon, I mean, you're totally exhausted. And I mean, I see the doctors at lunch. I mean, they're just really, by the time you're dealing with the last like 20 patients, it is so difficult to like sort of concentrate. And you can just imagine if 200 people came to you like and they're all suffering and they're like, doctor, give me this, blah, 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 blah. It's and they have to do this, almost daily. Right. And so I'm very, very sympathetic, as to the clinicians in China. And a lot of times it has to do with, it's less of a willingness, but more just of a systematic issue that you're dealing with. And that's why part of the reason why the existence of the private hospitals is to try to, sort of mitigate or to supply a better experience and a better service for people, to start out with them and for people who can afford it. And so that's sort of how this is this has come up. But the biggest problem with the growth of private hospitals is the fact that for good or for worse, most of the resources are still in the public hospital system, meaning that if you join a private hospital, a lot of doctors are looking for sort of increasing status and research and prestige. You just don't get that actually in a private clinic. I think it's somewhat the same case in the United States, but it's probably even more prominent in China. And in particular, most people don't know less about doctors, and it has to do with the fact that you're not allowed to advertise medical services. And so you can't really, that's a law. And so because of that, you can't really advertise. It's very difficult to advertise specific doctors. And so most people in China are sort of associated with with the institution. In fact, I mean, you can almost argue that's also the same case in the United States, right? You know of prominent doctors, but mostly you go to the doctor because they're a doctor at Stanford, or or they're a doctor at UCSF, or they're a doctor, at MGH or the Mayo Clinic or Cleveland, things like that. But there's somewhat of a similar mentality here, where I don't really know, and it has to do with, I think, patient informational asymmetry. Let me see if I can pick up another slide here that I think that this is that would be interesting. hospital, this is an interesting slide just because, people are always wondering, where hospitals make their money from, and you can see there's a huge number here where, that a lot of it actually is made through medicine and pharmaceutical sales, right? And that actually led to very, very sort of warped, you can say, warped, incentives, right? Because a lot of this is why patients in China sometimes, you go get treated for a cough and you walk away with tons and tons and tons of medicine, and a lot of it has to do with the fact that, if your product and services, you're giving, medicine. I mean, you have to survive. Your revenue is coming from medicine, pharmaceutical sales. It's a problem. That being said, the government very recently changed the law in order to sort of, they stopped allowing sort of a markup in medicine, pharmaceutical sales. But even though that's the case, there's still somewhat of a markup, and still this particular turquoise number has been squeezed quite a bit in the last, well, I would say the last year or so. So it's making Chinese public hospitals sort of rethink how they do this. So they're trying to increase hospital services, but the price to see a doctor in China is just very, very low. I would say, so the reason why the 2 or 3 minutes is because you're basically paying something like 20 to 30 RMB to see a doctor. So 20 to 30 RMB is that's like $3 to $5 to see a doctor. So I mean, there is an argument that you are, you're getting what you pay for. I mean, $3 to $5. But again, it's to be. But as a result of that, almost everyone can afford to see a doctor, including, and a lot of this is also covered under national health care. Let's see, what else do I want to, sort of mention? This is another thing that I think is really interesting. And it's a little sad. I mean, but it has to do with the disease factors, right? I mean, one of the big issues, especially from looking, again, all three sectors of healthcare look at this, but in particular, right, if you're a provider, you're going to see, I mean, what should I aim for? And the reality is, a lot of people, I mean, China's done a very, very good job of solving all of, like you say, the developing country issues, meaning that, issues that, when you had, parasitic infections and things like this, or very, that a lot of those, even tuberculosis, a lot of these issues have been actually solved, you can say, I mean, from a public policy, public healthcare perspective. But now the issue is sort of, you can say, China is now dealing with wealthy, or middle class, or middle to middle upper class health issues, which is a lot of times the issues that we in the West, in the United States, are facing. Obesity is a huge problem. Obesity then, of course, leads to, diabetes is a huge problem. And then, of course, since people are living a lot longer, cancer, is a huge problem. Most people actually, the cancer incidence rate in China is very, very high now. And I think it has to do with the fact that people are living to the point that, lifespans are much longer. So you're living to the point where now you have cancer. And so, and the issue is cancer in the US is actually very, very much a multidisciplinary cross-team a treatment plan, whereas that's difficult in China just due to the structure and the way I had described the healthcare system. So, here are some examples of cancer, unfortunately. The most prominent, case, percentage is lung cancer. Again, this has to do with primarily, even less about pollution. Everyone's talking about the pollution issue, but it's really about smoking. Smoking is such a, it's still very, very prevalent in China, especially if you now, luckily there's anti-smoking, sort of initiatives happening in the tier 1, 2, and 3 cities, but it's just, it's a huge issue. As you can see, percentage is very high. One of the, as effective as you think China is about, pulling out national, national initiatives, I think the reason why, smoking in particular is very difficult to solve is the issue that there's actually competing economic resources here, right? In the sense that, there's you get a lot of good taxes from selling cigarettes, right? And each of the provincial governments actually have their own cigarette brands that they sell. But then, now the reason why there's a big push in places like Shanghai and Beijing, because now the economic impact of actually dealing with those cigarettes is actually probably now sort of outstripping the tax revenue you get from the cigarettes. I know it's very sad to say, but I think there is also element of economics involved in this. But lung cancer is a huge issue. Unlike the West, the percentage is a little different. In the U.S., I think lung is also very prevalent, unfortunately, but breast and prostate cancers are much higher prominent, much higher prevalence in the West. In China, it's gastric and liver is even higher. So I think that's also different, and as a result of that, there's been a lot of times where I've seen doctors actually doing clinical trials. In the U.S., they require a lot of times you require multi-site location because you just can't enroll enough patients. Whereas in China, because of at least within gastric and liver, you just have such such higher rates. So as a result of this is sort of cancer intervention and cancer cases in China. 2015, I know it's a little dated, so I acknowledge that, but I think that from my experience, when I'm talking to doctors, that at least the ranking hasn't changed. Let me put it that way. The ranking hasn't changed in the way that when you ask people like, what are you seeing? It's still lung, gastric, and liver. Let's see. The final point I think I want to let's see. And then Dr. Dasher, we can jump into a more dialogue, and then you can ask. But I actually want to also mention this because I'm talking about China, and I get all these questions about China, U.S., and especially since I've been working with regards to cross borders. I always want to mention the fact that the U.S. and China, and partly it's because at Stanford I was a history major, but I always want to mention that the U.S. and China have actually had a really, really interesting experience in the sense that U.S. has been involved in Chinese healthcare for over 100 years. Many people actually don't realize this, okay? But some of the top Chinese hospitals were actually set up by missionaries, specifically, from the U.S. And one of the most famous hospitals, Peking Union, Chinese is Shih-Hung. It was actually set up by the Rockefeller Association, as well as this is partly also I think partly funded by some of the Boxer indemnification. So that's a very, very prominent hospital in Beijing. A very famous hospital is called the Yale Hunan Hospital. It's in China now. It's called Xiangya Hospital. Many of the sort of Chinese top doctors actually graduated from this medical school. This school was set up basically by a missionary from Yale, and in the very back in the day, it was called the translation for Yale was called Yali. And so that's why you see the Ya, right? And that Ya is basically from Yale, right? And so for anyone who's really interested, it'd be fascinating. You should see the guy's papers. I mean, he eventually, moved back after setting up this hospital in Yale. I mean, he moved back to Yale, and I think his papers are actually in the Yale archives. So it's fascinating to see that. And of course, Huasan Hospital. It was a Red Cross hospital, and it actually served as a teaching hospital for Harvard. I mean, it was a direct affiliation. If you take a look at Harvard's, back in the, it was actually an affiliated hospital of Harvard, even back in the day. But this is 1913 to 1918 is basically Republican era China. At that point, a lot of the hospitals, a lot of the U.S. institutions actually, especially interesting enough in Shanghai, many of the high school students were taught actually in English. I mean, it's very different than you see now. But some of the top doctors, if you talk to a doctor that was 1960s, 1970s doctors, many of these doctors actually were completely fluent in French, and completely fluent because they had learned, I mean, their medical education was actually taught in French. This is another reason why in Shanghai, in French concession, this is another reason why there's a lot of ties between, China, Shanghai, and actually the French medical institutions, because they were, I mean, a lot of the professors, at least when I talked to their professors, were actually taught medical terms in French. So apparently there's a different way that you hold the scalpels. That's the practical. They were saying that, oh, we hold our scalpels the French way, and where Americans actually, apparently, use scalpels differently or something. So anyway, I always want to mention that because it puts in context, as much as you hear about, U.S. and China and stuff, but, relationship between the U.S. and China is not just a very recent thing. It's actually a very, very historic and 100 years, relationship. So it's always useful to put that in context. So why don't I just, maybe pause there, and then Dr. Dasher, if there's areas that
I've got some things that I want to ask you questions about. And for everybody in our audience, while you're thinking, feel free to write a question in chat, and I will give that to Shih-Hung as we're going along. So the picture that you painted, Shih-Hung, really shows the challenges of a huge number of people who need, healthcare, the huge number of people in China. So as the East Coast cities, you have more middle-class people. Are they kind of driving more of this movement toward the private sector hospitals or private sector services? Are you seeing much of a shift on the demand side between what Chinese people, pardon me for putting it this way, are willing to put up with?
It's really funny because the reason I say it's really funny is because when we were first looking at this market, that's actually generally what you would see. I mean, you generally see like this, you can say is the wealthy areas, the coastal cities are actually driving higher services. But what I'm finding is actually especially in the last 2 to 3 years, I think because of the development of what's considered tier 3 and tier 4 cities. Tier 3 and tier 4 cities are basically what you would call, if Shanghai is a tier 1 city. So maybe the best way to describe it is, I'll use a California centric one, right? If San Francisco is considered tier 1, then maybe Stockton would be considered like a tier 3. Sorry guys, for real, it'd be considered like a tier 3, right? Tier 3 city, right? I mean, but Stockton's not small. Let me put it that way. I mean, it's like, so when we say tier 3 cities, we're not talking about small cities here. We're still talking about pretty major cities. I mean, a tier 3 city is still like 1 million people. Like that's their consideration, right? I mean, it can't compare to the mega cities of like 20 million, but you're still dealing with 1 million people. The reason I describe that is because a lot of the very recent entrepreneurship and recent companies are actually focused on providing services in tier 3 and tier 4 cities. The reason why is now they can afford much better care. A lot of times, a lot of these people have actually spent time in tier 1 cities. They're going back to their hometowns, and they just don't have medical care. I mean, and the sad truth is, when you go from medical, tier 1 to tier 3, the medical expertise drop off is incredible. I mean, I apologize because the slides are, I mean, there's so much to talk about, I guess, and such a complex issue.
It is a big, it's a big issue. Yeah. So in that regard, are you finding any demands for new services? So for example, plastic surgery is a big hit in South Korea, right? Are you getting a lot of private sector supplying of those kind of things? Yeah. I don't know how that would fit into national health care.
Yeah, I mean, the biggest part. I mean, I should have mentioned that before. I mean, part of the reason why I have a bias, you can say, against that is because I've been working with sort of the U.S. hospitals, and U.S. hospitals generally try not to focus too much on what they call, I guess, consumer healthcare, or, sort of, and so consumer healthcare in this particular case would be, plastic surgery, they would even argue maybe dentistries with regards to this area. These are the areas that actually have the highest penetration of private clinics. You have a lot of basically, plastic surgery, and as well as a lot of dentistry, and a lot of cosmetics. What other areas? These two are probably the most prominent, and these, as a result of these are actually the most prominent ones that you see with regards to what I described the Putian system. A lot of the Putian hospital systems, that have private investors are actually mostly with regards to, you sort of elective or very, very consumer-based healthcare, and that's the area. Most of the public hospitals, while they touch somewhat in the cosmetic surgery areas, they generally don't. They generally don't service that as much. So that's sort of the nature. Yes, the answer is yes.
Yeah, okay. Prakash has asked a couple of great questions, but I want to change them a little bit. One, I want to ask more generally about traditional Chinese medicine. How does this fit into the situation for healthcare services, especially in terms of business opportunities? Are you seeing a lot of people going out into the forest and finding traditional herbs and kind of figuring out they can do something with them, or?
So maybe I should, you had mentioned this comment before, and I should probably add this question about sort of, healthcare investment opportunities. Let me take a step back and just maybe address that point. Okay, which is, what are the opportunities? There's been a trend about, sort of dropping, less funding with regards to healthcare, or less funding with regards to seed. I would say that seems to not be the case within healthcare as a whole. I was talking to a clinical person.
People in the audience don't know that we had this exchange. I pointed out to Shih-Hung that seed funding is down 40% in 2020 over 2019, and whether that was, what kind of an impact that was having. So your comeback is, first of all, in healthcare services, it's not apparently down.
Not really.
Yeah,
and most people were saying, like, if you had just sort of even a half a good idea, okay, people would fund you. If you had a medical background, people would fund you. That's also anecdotally what you hear. I think with regards to sorry to jump into the question about TCM, or traditional Chinese medicine. There actually is, there's always been a lot of entrepreneurship in this area, and specifically, with regards to, there's the way I look, and this is my personal opinion about this. I think TCM is it is somewhat controversial. In the sense that I think that some of the TCM issue is the fact that it's very, part of it has to do with the paradigm, is that it's hard to actually it's hard to actually use an evidence-based medicine approach with regards to TCM. So, we've seen examples of TCM, actually, sort of TCM products actually coming out and making a huge change, right? For instance, like if you're able to refine, I think one of the more recent, malaria drugs was actually sort of developed from TCM. So there's definitely value in that. But TCM as a whole, with regards to how you eat herbs and stuff like that, there definitely is sort of you can say like there's two schools of thoughts about this. And even in China, when you talk to Western practitioners, sometimes they definitely poo-poo TCM. But TCM, I think from a cultural perspective, when I look at it here in China, sort of operates under what I would say, what they sort of take the place of what I think in the US is primary care. So a lot of times, when you have small case, or you have a cold or something, you just go to a TCM doctor and you have some herbs. Now, whether that's truly effective, I think this is again where, if we use the evidence based medicine approach, sometimes it's hard to actually determine. But from an individual perspective, a lot of people actually do feel better after taking TCM, and so there is a market for this. The other issue, the biggest issue with services, and I think this is something coming from a retail background at Staples, is that it's okay. How do I say this? Maybe the other way of describing it is it's okay. It's easy to set up it might be easy to set up one successful restaurant, but it's very difficult to scale that restaurant up, right? And most retail stores have the same issue, right? You can set up one store, but if you have to set up 1,000 stores, right, then it becomes very difficult. This definitely applies to TCM in the sense that you might have one great practitioner of TCM, but then how do you scale that up? right? I mean, TCM is very, very much a sort of a mentor sort of, it's you basically have to follow, you follow a teacher, right? So if
Shih-Hung, is TCM mostly compounds, pharmaceutical type things, or is it also includes things like acupuncture and various sorts of pressure therapy and so forth, right?
Acupuncture, cupping, pressure therapies, a whole bunch of different things. Sometimes there's also different ways of impacting chakras. It's pretty. It encompasses a lot of different areas.
But are you seeing that grow much, or is that just sort of always there?
It's always there, and I don't. Yeah. I wouldn't say that it's growing any more rapidly than other areas.
Okay.
I would say it's growing in sort of with percentage with regards to as a whole of healthcare services growth.
Okay. So the other question that Prakash had asked has to do with the kind of cutoff, drop off in the availability of medical talent at tier 3 and below cities. So there are several solutions to this, a lot of which involve technology like telemedicine and also the use of AI. I'd like to ask you kind of generally about both of those, telemedicine first, and then use of artificial intelligence and other kinds of advanced analytics, not so much at the research stage, but as a way to help increase, say, access to good diagnoses.
Yeah, it's funny that that you're asking me this question about AI. It's like literally last night I was having dinner with a couple of clinicians, and they were actually talking about AI.
Okay.
Because they were saying, the hospital initiative is to actually push out more AI. Okay, but the clinicians were like, yeah, whatever. I mean, clinicians are usually like, yeah, whatever, AI. And I think that has to do with the fact that they're clinicians, right? I mean, for anyone who's a clinical, there's always I digress here, but the drop off between tier 1 and tier 3 is very, 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 very huge. And the reason why it's huge is because of medical education in China is not that standardized. So you have a basic level of medical education, like the national, but there actually is no, there's no like MLE, like the US style, medical licensing board and that area that's applied on a national basis. It's basically still applied for good or for worse on a regional basis. So you basically have great, I mentioned these, very famous, medical schools, right? You have like, Shanghai Hospital, in Hunan. You basically have Beijing, the Shih-Hung hospital system. You have the Fudan and Jiaotong system in the south. So you have a couple prominent ones, but then they drop off, right? And then a lot of these other hospitals, they just the quality of medical education is just not the same. And since you don't have a national licensing board, basically, you have a regional-based licensing board. It's very difficult to have the standards don't exist. I mean, the standards don't exist at level. So when you hear a doctor, from maybe a smaller, and that leads to a lot of problems, because when you see a doctor from a smaller town, okay, they have the same MD as a place from Shanghai, right? But their medical education, their experience is really, 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 really different. And the amount of education, a lot of the people in Shanghai have done observerships, or they actually actively work with collaborators internationally. Whereas, whereas you just don't have that opportunity when you're from a smaller tier 3 city or tier 4 city. So that's one element. And so that leading into the other element is, of course, telemedicine and AI, right? So how do we solve this problem? Can we use technology to sort of, increase the, increase the availability? So the issue with telemedicine, I think, so telemedicine hasn't really taken off in a huge way in China. I mean, people have been talking about this for a long time in telemedicine, and you see a lot of, even within our sort of our district here, you have a lot of these, sites that talk about, oh, you can do telemedicine here, telemedicine there. I just don't see that being that prevalent, telemedicine being that prevalent as a whole. You see examples. I mean, it's not like it's not being practiced. And when you talk to most doctors, they're like, yeah, we have a telemedicine center, et cetera. But as a percentage, it's not that huge for two reasons, right? One is, while COVID actually changed the you can say the experience in the US where, telemedicine was forced upon, you can say it was forced upon everyone.
A right? Video visit with your doctor. Yeah.
Yeah. I mean, in China, that because COVID was actually handled, was sort of really, COVID was really shut down the country for about 2 months. But after the 2 months, people basically went back to the way that they did things. So, the hospitals, I mean, when I talked to the clinicians, yes, they were basically empty for about 2 months. But as soon as the, 2 months lockdown was over, the hospitals, now have a gazillion people again. I mean, they're basically back to like the 12,000 outpatient, people they did before. So that behavior hasn't changed. The other thing that's interesting about China, about telemedicine, is that I find that, maybe this is a cultural thing, but people are just used to traveling. So in the sense that, if you have a family member that's sick in, for example, the catchment area, I think for Shanghai would include, provinces like Zhejiang province, or maybe even Fujian, I mean, the province. So these places are about, I would say about, 300 miles away, 3 to maybe 600 miles away. People are really quite willing to just get in a car and drive all the way to Shanghai. And so I've seen numerous cases where it's like, oh, this, this person's, relative was sick. So they ordered a taxi. We got to take him to Shanghai because it's the best hospital. So, I mean, they taxi, and the taxi 8 hours of, sort of travel to Shanghai to wait in line for 4 a.m. Right, to get there, so they can see the hospital. So that sort of, unfortunately, that leads to the this is why telemedicine is an issue, right? You say, oh well, you should do telemedicine, and telemedicine can take care of it. But I think there's somewhat of a more, you just feel more comfortable by just getting in a car, and it's like, I just want to see the doctor, right? And so that then leads to the last problem, which you said, AI. Right. I mean, there's still an element of, I think with medicine, sometimes we think about AI, and if you talk to any clinician, I mean, the clinician will just tell you that, yes, okay, there's a general way that you treat people, right? But, most of the clinicians will push back and say like, well, everyone's different. So it's, and there's a huge art in the practice of medicine. It's, I mean, the two clinicians I talked to last night, one was sort of gastro internal medicine. Another person was an internal cardiologist, and they said, a good clinician will know that there is really no one formula. And so, and the argument actually, the clinician, I think I mentioned this, the clinician push back and say that, percentage, a lot of times AI deals with percentages, right? So the percentage of you, I mean, like you have a 90% chance of being this, or you have a 95% chance of being that, or you have an 85% chance of this being the case. But she says, if you're a good clinician, you want to find that the 5% chance that the computer's wrong, right? Because if I can find out that if I'm being aware of the 5% chance that the computer's wrong, and like, you don't have this disease, I basically change your life. So I'm out there to try to find the 5% or the 1%. So a great example is like, there's like 98% chance that, this particular disease is really, but there's the 2% chance, right, that it's not. If you're that 2% and actually it's, the clinician just said that, these are people's lives that we're dealing with. It's not just a statistic, right? If I just say, oh, 98% chance you have this, like, terminal disease, bye-bye, right? And you've basically destroyed this person's family, right? I mean, this person will treat it. But if I go out of the way and I look and just like that 2%, I'm looking for the 2%, then, that person's life has changed, right? And so that, again, that's the challenge with AI, right? I mean, AI a lot of times, it's percentages, and so you go there, and so AI will help, definitely. There's things about having a toolbox to actually help, but I think it's, at least the clinicians will push back. At least this is what the clinicians are telling me. They'll push back and say that, yes, we'll use them as a tool and they can help me a lot, but the reason there's a but there is that these clinicians are already operating really, really fast. I don't think it's very possible to actually be faster than 2 to 3 minutes per patient. It's like if the patient experience was like 30 minutes and we shrink the 30 minutes to like 20 minutes, right? That's a huge improvement, in efficiency. But, the argument, and when I've talked to clinicians from the US visiting, when you're dealing with 3-minute consults, how much more efficient can you get? You can't, you're sort of pushing at the efficiency levels as it is, right? What, you go from 3 minutes to 30 seconds? The reality
so Shih-Hung, is there a movement to try to store patient data better so that to improve continuity of care?
That's actually a huge effort among different the different provinces. So you see that in Shanghai, you see that in Beijing. Shanghai has this sort of centralized centralized repository where your medical records should be actually transferable between hospitals. I think the issue with that is that each of the hospitals, and this is the case in the US as well, right? Each of the hospitals have really Byzantine systems, and no one wants to share data. And even if the government is out there trying to, as you can say, as powerful and as effective, as the Chinese government is, they still haven't been able to get all the hospitals to share all the data. It's really, really difficult. I think it has to do with the fact that data is being stored in so many different places. It's hard to completely centralize it. And then once you centralize it, then how do you sort of share it among, it basically requires all the hospitals have standard systems, the same system, the same sort of the way they talk about codes and things like that. And that's it's not quite there. And so that's really hard. Most of the times, you see the patients basically print out their stuff or they download their pictures, and then they have to go to another hospital if they want another consult.
Yeah, I do want to point out that this is very much still the situation in the United States, that you've got a lot of incompatible systems in different hospitals, different places in the US. And, it's kind of back to the AI issue, though. You've got the clinical practitioners on the one hand who are very conservative, and this is the case in a lot of other places too, but you've got these huge government policies identifying AI as a national strength and really throwing an awful lot of money into that. I know we're really talking about services more than about the research and advanced, that kind of thing, but surely the healthcare system in China is really moving rapidly in regard to advanced AI for, in the research area.
They were definitely talking about that. Even yesterday, the two clinicians that I was having dinner with, they had mentioned about, sort of Watson, IBM Watson was actually actively being sold in China among different, and Watson was very effective in the sense that they would pull data from, numerous papers and stuff and do things. The doctor's comment was, at least the way Watson was implemented in China, I don't know enough about Watson in the United States, but the way it was implemented in China is that it wasn't hooked into the hospital systems, in that it didn't actually reinforce its learning, I guess. So that they would offer things, but it didn't actually actively learn from the cases that weren't A or weren't B. So maybe that's something that they're trying to improve on going forward. The government's definitely pushing AI in a big way, but I think that there's a from my feeling on the ground is there's questions like how do we solve that issue? How do we solve that issue of doctors, hands-on patients, right? Do you know what I'm saying? How do we solve that issue? And so let me push back and say that there's certain things that actually are more susceptible to AI. For example, things like radiology. Right, but radiology. There's been numerous examples of radiology cases where the AI system actually picks up
So this is basically image recognition, right?
Basically image recognition, right? We're talking about image recognition. So image recognition is a great one that's really useful for AI. Another area, I mean, people talked about dermatology, right? Dermatology is, again, because we're dealing with, image recognitions. The really fascinating area that's happening, at least at Stanford, I know they're doing a lot of research in this area, but also internationally, I mean, in China, is radiotherapy. Right, because when you're dealing, again, it has to do with images, right? I mean, you're dealing with the radiology images, and how do you plan a treatment plan around it? It right now is a very, very laborious process where the medical physicist has to go there and draw things out. Whereas, can we use AI for that? So I think AI is important as a tool, but I think AI as a diagnostic system, I think is going to be still challenging. Again, because going back to the point is, yes, they can give you a percentage of what this could be, A or B, but you really need to have an experienced clinician to test things out where if it's not that. Right, but with certain areas, as I said, as a tool, like as a tool, like to sort of scan through. For example, it's like a calculator, right? I mean, you could do it yourself, but if you're able to use it as a tool to scan through things faster, I mean, that will help the clinician operate at a faster pace.
Mm-hmm.
And actually, it would also lead to better standards. So for example, one of the biggest issues, some of this. A big difference between the U.S. and China system is actually, I think, within pathology and radiology. And I think that, and so this particular area, having AI there as a support actually would do a lot of work, would actually help quite a bit in being able to, maybe bring everything up to a standard level.
Okay. So a lot of the kind of things that have made a lot of news in the US, Made in China 2025, or indigenous innovation, or AI as a national priority, and so forth, don't really seem to reflect the government putting, healthcare, right? This kind of help providing of services. Are you seeing a major push by the Chinese government to try to improve the situation in tier 3 areas? What kind of things are they doing?
Yeah, I mean, there is the government definitely is doing a lot in trying to. I mean, one of the biggest policy that a lot of times actually in the West, we haven't really noticed much is actually the anti-poverty sort of initiative that China has actually, the central government has actually done. It's changed a lot in the last 3 years or so. The anti-poverty initiatives. It's a fascinating initiative in the sense that you have what's called the richer coastal cities being paired up with poorer provinces. So you basically have a poor province in Yunnan that's paired up with like Shanghai, a district in Shanghai, and the district mayor is responsible for actually bringing all these guys in bringing the entire GDP of this small town in Yunnan to out of poverty. So exactly. I mean, and so the reason I bring that up is because that bringing people out of poverty also basically impacts sort of medical. So these central, you can say, these major hospitals within, sort of Shanghai, Beijing, Shanghai, and Guangzhou also have, sort of, you can say buddy system or buddy system or, little brother, little sib, right? Little sibling relationships, okay, with a lot of other, provincial areas, either, for example, some are in Shanxi, Yunnan province, Guizhou province. So a lot of times the Shanghai doctors or the Shanghai, sort of these hospitals have a responsibility. I mean, their direct KPIs is to actually make sure that the healthcare is being delivered out there. So there is. But the issue actually, interesting enough, is if you're in one of those areas, it's actually, you're getting more attention. But the difficult areas, I think the more difficult places are the areas where, you're not poor, right? I mean, you're like the entire area around, when I say, coastal cities, like Shanghai. So if we go to a place like a neighboring city from Shanghai, like Jiaxing, right, is a good example of this. I mean, these guys are not considered poor province, at all, but the medical care really drops off, right? I mean, if it's the way I would describe it.
Shanghai instead.
Exactly. I mean, so from the Bay Area perspective, okay, I mean, the distance would be basically like what Gilroy would be to Stanford, right? That's sort of the difference. I mean, so, but you know, you don't, maybe this argument is in Gilroy, you don't have good medical care either. I don't know. I mean, I apologize to anyone from Gilroy, but you know, I mean, but you sort of have this drop off, okay, where, you know, especially in Shanghai, I mean, you have a huge drop off where, you know, people in Jiaxing, like, you know, maybe I should just go to Shanghai for anything serious. You know, I mean,
is there a system for like local referrals into the big hospitals? And in that case, let's say that, you know, somebody has a particular type of cancer, and so the treatment that's most advanced is in Beijing. And so, you know, the local doctor, wherever they are, would refer you to the specialist in Beijing. And then when you go there, maybe there are opportunities like housing is available or that kind of thing for the family to be there. You know, that's the system in the US is very much concentrated on a few really leading edge centers too.
Yeah. So the way that works in China is that, you know, the doctor in you know, the sort of tier 3 city will say that, yeah, you should go to Shanghai to see this because Shanghai probably has better, and they leave it at that. In the sense that, you know, you sort of have to find your own way. There is no sort of very, very formal.
Then you're on your own. Okay.
You're on your own, right? I mean, you know, I think that's just even within the Shanghainese hospital system, if you have to cross different specialties, you're sort of on your own. I mean, there's no internal referral. So, I mean, and so if you see.
So is that an opportunity? Is anybody trying to take advantage of that kind of thing so that people would have a better network kind of available to them? This is kind of like One Medical in the US.
Yeah. I mean, One Medical was actually also the CEO was the former CEO of Stanford Healthcare, right? I think if I recall. Yeah. So you know, there's quite a few Stanford ties there at One Medical, but I think the issue, people have tried to do that, you know, I mean, to do a referral system, you know, you've seen the big players like, you know, Ping An Health, Taikang, or, you know, a whole Tencent, you know, these guys actually, you know, and one of the more recent players, JD Health, actually is sort of doing different things with regards to medicine and, you know, and telemedicine and online stuff. I think the issue is that, you know, people are just so used to just getting in line. I mean, there's such a simple habit. It's like, oh, if there's something serious, we're just going to drive to Shanghai, or we're just going to drive to the major city, right? Because it's just easier that way. Yeah. That hasn't, you know, I guess that culture hasn't really changed yet. It might. I mean, I think that there's a trend that will happen, but still, I think the, you know, prevalence of it, I mean, is for people just pick up and drive or get a taxi and then go to the major city. And then when you're basically, and the interesting thing is that there's a whole cottage industry of people. You could almost argue they're basically scalpers. You know, I mean, because I mean they really are scalpers in the sense that, you know, you have to get in line, and so the guy goes, you know, I have tickets, you know, I can get you faster.
Yeah, right. Break in line.
And so there you basically have you know, the scalper system, and that entire cottage industry has been around for a long time. It's very sophisticated. You know, you can say, is there any room for consolidation with regards to scalpers? I think there is, but the other issue is that if you do consolidate that, then, you know, then you sort of run afoul of government, because government doesn't want you to scalp these tickets, right? I mean, you know, I mean, right? It's sort of like if you scalp tickets yes, okay. I mean, you don't want to scalp baseball tickets, but you know, I mean, how do you make this official, right? Because the moment you make it official, then, you know, then MLB will come in and say, no, we don't allow this, and that's very much the case. So if you take a look at you know, Dr. Dasher, what you mentioned about, you know, the healthcare, you know, sort of getting in line, as well as, you know, sort of hotels and stuff like that. I mean, it's all being sort of handled by this cottage industry. So when you're waiting in line, when you're waiting in line at 4 a.m., then you have all these people, you know, that are scalping, selling you services. Like, hey guys, you know, by the way, here, you know, if you're willing to pay me some more, I can get you in faster, right? And then, you know, you as a patient have to figure out, is this real, or is this guy, you know, is this guy, can I trust this person?
So separate from the cottage industry, that's a little bit shady. You were saying that seed funding and health services may not really be down that much this past year. What are the kinds of things that the investors are investing in? And are you seeing the investors really kind of driving this, or is there just this huge kind of groundswell of young people who want to change the world?
Well, I mean, there's definitely impact of people that are, so I guess now the current doctors, the sort of the workhorse doctors, are basically post 1980s and sort of they were called 80后, right? I mean, these guys are sort of post 1980s people are now becoming sort of department chiefs and stuff like that. And so this group of people actually, I think, is a little more flexible about thinking about other options. And actually, probably even more so is when you're dealing with even the younger doctors who are post 1990s. And they're much more willing to sort of, I think they're less willing to sort of wait in line. I mean, the medical profession, unfortunately, in some sense, is very much of a, you just have to wait, right? Wait till your time, so you do your time, and then when you get to this certain age, then you go to the next level, And I think that when you're dealing with a younger population, I mean, people are less like, I don't want to deal with with this stuff. I don't want to be abused and take sort of taken advantage of by the sort of previous chiefs per se. So there's an opportunity for there. I mean, and so what investors are looking for, I think one of the things that the conclusion that people have started to come up with is that you really can't compete with a public hospital. So that's the area that I think people have sort of settled down and say, like, look, okay, I mean, places that are trying to do a straight up, like, we're going to do a public hospital type service, but better service, I think it's hard. So the areas that people are trying to invest in are areas that are, I would say, complementary to public hospitals, because you see the public hospital system is sort of, really, you can say terrible, right? I mean, I can't say terrible. I mean, the quality of service.
Giant gorilla. Yeah,
it's a giant gorilla, right? I mean, that's very easy to fall through the cracks. I mean, if you're able to find a great doctor, if you're able to really navigate the system, you'll get great care at really low prices. So if you have like a friend in the system, like I'll tell you, like a friend, like a clinician friend, if when I introduced my friend to them, I mean, she got great care, right? Because the clinician basically walked her around, right? the service, and she's like, okay, and she cut in lines, like, hey, like Dr. Wong, hey, help me look at this, and you just like, she sort of comes like, and because they're colleagues, right? They would just professional courtesy take a look at it, right? And help, right? So if you have that, then I mean, and then the prices, of course, at the public hospitals are all subsidized and they're very, very low. Now, so the opportunities around this are areas that, for example, as you said, Dr. Dasher, the continuity care aspect, I think there's definitely room to grow within this area, right? For example, having, you could say a concierge type of service with regards to cancer in particular. I think with areas with regards to cancer services as a whole, there's still quite growth opportunity. The other area, of course, the area that I've been actually sort of been really fascinated about is hospice care. I think unfortunately the end of life care in China is not handled very well. Partly it's cultural, but partly sort of lack. There's a lack of expertise. But the biggest thing holding back, I think, entrepreneurship, in hospital services, is the fact that it's the lack of expertise, right? I mean, you really, I'm not a doctor, I'm not an MD, right? So I can't set up a rehab clinic, right? As much as I want to set up a hospice care, I need to find people who are you need to find medical experts, right? You need to find MDs that know this stuff, and as much as you see those numbers about there's so many doctors out here, really trained doctors are just very hard to find. And I think that's the case everywhere in the world. Unfortunately, medical doctors, trained MDs are just a rare resource wherever you go. So, one of the issues that you see with telemedicine stuff is that, are we really solving the problem? Or are we just basically, stealing from Paul to, give to, there's part of it that is it really making it more efficient, or I'm just redistributing resources? Right.
So one of the reasons that I wanted to have this topic for our China session this spring is because of all the US-China issues. I've heard that healthcare may be an area in which US and China can still cooperate. Are you seeing many, either foreign investors or foreign entrepreneurs sort of setting up shop in China?
I think this is very much the case. I mean, healthcare is one area that I think, I mean, there's areas that unfortunately, with many things that are in high technology, you're seeing a sense of competition. And sometimes, there was definitely, unfortunately, a case of, whereas, one Chinese hospital sort of canceled a collaboration because they're like, oh, it's an American institution. We're worried. So maybe we don't want to actually sort of send in this collaboration. That being said, I think on a sort of provincial level, let's not say on a national level, on a provincial level and a hospital level, hospitals are really still looking for collaboration opportunities. I think that the challenge with the collaboration opportunities is like, where do you start? Right, because what I was on a call with a hospital, a U.S. hospital, about a week ago, and it's a U.S. hospital, and they had talked to tons and tons of Chinese institutions, and there was sort of this frustration, and it was really sort of unfortunately very disappointment. It was like, we've talked to so many people and we just can't figure out how to make this work, right? We don't know where to start, and because one of the areas that the Chinese hospitals only want to do is they say, oh, what's the most interesting technology you have? We want to do this technology stuff. And so from the U.S. hospitals perspective, it's like, yeah, we're happy to share, but we need to figure out, it's a team thing. It's not just a magical surgery that will solve the entire problem. So I don't know. I think there's definitely an area, and I think everyone wants to collaborate, and I think the challenge is to figure out what areas. And I hope that people have more patience, in the sense that it's the other issue I think that's really hard is that most hospitals are actually so siloed. Right. I mean, so U.S. hospitals actually really know their own system really well, but it's even if you're at a Stanford Healthcare, right? I mean, how much do you really know about the Chinese medical system, right? You spend, if you're a clinician, you spend all your time, treating patients. It's the same in China, right? If you're a clinician, you spend all your time, and your primary focus is actually on the people, your patient population. So how much time do you have to actually sort of collaborate and understand other people's systems? And I think that lack of understanding actually leads to difficulty in collaboration. But the willingness is there, and I think this is something that I hope that people take up the challenge. Because this really is a problem for our generation. Right. Healthcare is I think is really, really important. And so we should, anyway.
Yeah. 2 questions, and then we'll finish up the formal part of the program and keep talking with anybody who can keep talking. Michael asks, how can we incentivize public hospital doctors to move over to the private sector? Can you offer them more competitive pay? Because that would seem to be a key to encouraging more entrepreneurship.
The biggest problem right now is actually, that stopping that is actually, government incentives. The government has actually sort of, the Chinese government has actually sort of wants to encourage private, but you have this tension in the sense that, the government wants to encourage private, but the healthcare authorities are actually all from the existing system. So if you're a health minister, you likely were formerly like president of Hunan Hospital, right? And so you basically know everyone there, right? And so when you went to become health minister, right? You're likely your mentee is now the president of the hospital, and the president of the hospital, the last thing they want to do is to have all their doctors go out into private practice. At Stanford, it's the same problem, right? You don't want like your top doctors to all go out in private practice, because then the result is like, who's going to see the patients at my hospital? So you have this tension where it's like, yes, okay, the government, and from economic perspective, we want the doctors to go out, but you have the existing forces, within the healthcare system that says, no, we don't want you to go out, because if you all go out, okay, then who's going to take care of the public hospital system? And so that tension is hard to resolve. So you in the sense that, so you see, the government has officially allowed people to have what's called, multiple areas that they can practice. Okay. But in practicality, a lot of the hospital presidents say like, if you go out and practice, okay, we're not going to give you this bonus. right? Or you're not, we're not going to promote you, because if you go do this, we're not going to promote you. So all that is done sort of under the table. So you see a lot of these doctors actually under the table go to different practices. So the argument I would say is that a lot of these public hospitals are already doing these, like what's called and
but
under the table.
It has to kind of stay under the table, then there's no way
exactly.
to really make it grow to the point of being on the surface.
Exactly. That's the problem.
Yeah. So last question for the formal session. You may know about the pilot project in Hainan about international medical tourism.
Yes, that's very familiar.
So what kind of an impact is that going to have on the situation with China, inside China?
So, Hainan is actually, I've been to Hainan, I've been to Boao many, many times. And as far I'm somewhat negative on Hainan. Okay. The reason why I'm negative on Hainan before was because, it's a geographic issue, right? I mean, if you have a choice of going to Hainan, or you can go to Japan or Korea, right, which is basically about the same distance, from the major population areas. If I had to fly like 2 hours, or from Shanghai, let's just use Shanghai as an example. From Shanghai to Hainan, it's a 3-hour trip, right? And Hainan basically is arguing that, okay, we basically have international medicine. You can get international doctors out here, but if it's 3 hours for me, it's an hour and a half to go to Japan. So I could just fly to Tokyo, or I could fly to Korea, right? Rather than fly to Hainan. And Hainan, for me, whenever I go to Hainan, Hainan is plagued by typhoons. There's so many typhoons there. I know it's a really stupid issue. It has nothing to do with healthcare per se, but healthcare is an experiential thing, right? You don't want to, if you're feeling bad as it is, you want to be well taken care of. If I go to Hainan, there's typhoons. I'm getting there and it's really hot and sticky. It's sort of there's a lot of mosquitoes. We're not talking about this. We're not talking about the beach area. The hospitals are located actually in this other area, sort of, a little more tropical. Yeah, and so that's one of the issues. I think as a whole, the services just isn't quite there. However, I would say COVID has actually given an opportunity. Right. The reason why I say COVID has given an opportunity to Hainan is that now, your competitors, like Hong Kong, Japan, and Korea are not accessible anymore. So this past year, you had no choice but to go to Hainan. But still, I think even with that sort of, you can say, huge push, I haven't actually seen that big of a big push into Hainan. I think, again,
and you don't think that kind of international standard of care is going to spread out to the rest of the healthcare system?
I think it's very, very difficult. People are going to fight me on this one, but I think it's very difficult.
If you've got 12,000 outpatients a day, it's really hard to change the current system.
Yeah, and it's really hard to, it's nice to fly there for a vacation, but it's really hard to fly there if you're feeling bad. Right. There might be an opportunity for certain, I guess, experimental or maybe one-offs, but as an industry, I think it's going to be hard.
Okay. So we're out of time for the formal session today. I want to encourage everybody to come back next week, when our speaker is going to be Ms. Fujio Ishiguro, who is the CEO of NetYear Group, which was just bought out by NTT Docomo. And it will be interesting to hear her talk about accepting a buyout offer. But first, I want to say thanks so much to Shih-Hung for giving us a really frank, candid kind of opinion view of what's going on in healthcare in China, looking at the difficulty of, setting up these kinds of entrepreneurial ventures or relationships. But thanks so much, Shih-Hung. It was a really revealing day today.
Thank you so much. I appreciate it. It's always a pleasure to be on this forum.